I have the distinct honor of welcoming you to the morning session of the kickoff of the Community Violence Prevention Collabrative. And Commissioner Beckner and Mayor Buckhorn are looking forward to joining you this afternoon at 1 p.m., where you're going to get more information about the foundation and the vision that we're trying to bring forward. My job this morning is pretty dry. We have fielded a large number of questions from the Leadership Council members who appointed you, and from you who have been appointed, and from people who are interested about what is this thing, how will it work? And so my job this morning is to kind of just give you an orientation into the structure and the role of the subcommittees. So you can see by the organizational chart you have in your packet and the one that's up on the screen that 9 elected officials have been named to the Leadership Council. They were chosen because they lead policy change and they can inspire others to move priorities forward. They can also require participation and accountability over those over whom they have authority. Each of these officials to date has appointed 5 members to the subcommittees. 2 committees have not yet been named, and that is the Infrastructure and Business Committee. They will come in at a later date. And the Data and Communications subcommittees were not necessarily appointed. They come from inside the jurisdictions and the municipalities and the agencies of the Leadership Council members, like the communications people from the City of Tampa and Temple Terrace and Hillsborough County and Plant City sit on the Communications Committee. Does that make sense? To date, there have been 2 organizational meetings of the council. And at the August meeting, the last meeting, there was a lot of discussion that more people and organizations needed to be at the table with you on the subcommittees. In response to that conversation, the council invited guests to this afternoon's session, and it's hoped that many, if not all of them, will voice an interest in serving on one of the 5 appointed subcommittees. The subcommittees and the Leadership Council will meet on the same day each month, with the subcommittees meeting in the mornings from 10 to 12, and the Leadership Councils meeting in the afternoon from 1 to 3. Your role is an important one. Subcommittee members will not only consider the rates of violence in our community, but you will also look at unemployment, poverty, education, mental health and substance abuse, family structures, all of the things that span the broad continuum of issues, policies, and systems at the core of all forms of violence. You will also consider community strengths or resilience factors that prevent violence, but our consultants, Prevention Institute, will address this in greater detail this morning. Because Commissioner Beckner designed this process to be driven by data and best practices, you will make recommendations to the Leadership Council based on your analysis of that data and your knowledge of interventions that are known to prevent violence. The Leadership Council will then sort through your recommendations, and they will write a strategic plan that will be completed in June of 2014. That is our target date. This plan will change the way local policymakers address the violence in our communities. The Data Subcommittee has the responsibility of collecting demographics and statistics unique to Hillsborough County. And because there is not sufficient data currently available for you to review at this time, a decision has been made that the subcommittees will not convene until November 7th. But at that time, each committee will elect a chair and a vice chair. The chairs, along with the Leadership Council, form the steering committee. The subcommittee chair must attend Leadership Council meetings to report on the status of your work and will serve as the liaison between the Leadership Council and that particular subcommittee. The status reports from the subcommittees will be the first order of business on the agenda of the Leadership Council, and the chair will be free to leave following that reporting. But this time commitment will be a factor to consider when choosing your chair. And we wanted to tell you about that today so that you could be thinking about it for your convening meeting. There's another complementary structure that is and will continue to be important to this effort. I'd like to start by introducing Robert Salmon. I think you probably met him at the front table when you first came in. I want you to get an eyeball at Robert Salmon because he is your point person. And he is actually the special projects coordinator in our Intergovernmental Affairs Department. Robert will be the primary contact in the event you have questions or need additional information during this process. Robert has a direct line to the Leadership Council members and will be instrumental in creating their work agenda for each meeting. Bob Sheehan is a regulatory compliance program coordinator with our Consumer Protection Department. In addition to being the chair of the data committee, remember that, Bob will be the person responsible for meeting logistics each month. Brandon Wagner is the Legislative Affairs Officer in our Intergovernmental Affairs Department and has worked closely with Commissioner Beckner in creating the structure of the Collabrative and has provided oversight for the many details required to get us to today. I would need to personally acknowledge how helpful he has been in this process because without him I would be under the table. Prevention Institute is our consultant on this project, and present with us today are Benita Sal, Program Coordinator, and Annie Lyles, Program Manager. They have worked with 18 other communities across the nation that have developed strategic plans using this model. Prevention strategies have a demonstrated track record in reducing violence. Minneapolis has experienced a 40% drop in juvenile crime since implementing its 4-point public health-based violence prevention blueprint for action 2 years ago. Oakland's City-County Neighborhood Initiative targeted a geographic area of Sobrante Park and saw a 40% reduction in violent crime over 3 years, even while overall rates of violent crime increased. And last, but certainly not least, Dr. Herb Marlowe, a professional strategic planner and our local facilitator, who will work closely with both the subcommittees and the Leadership Council to guide us on our journey toward our goal. In closing, we know that violence is preventable, and today begins a process of preventing it before injury or death occur. Thank you very much for agreeing to be a part of this important work. Are there any questions? Well, that's wonderful, because now I get to turn the morning over to Dr. Herb Marlowe, who made me promise to tell you that he prefers to be called just Herb.
So let's begin by vacating the dais.
Yeah.
Well, good morning, everybody.
Good morning.
Thanks for showing up this morning. We appreciate it. Thanks for spending the next 17 years working with me. What we're going to do is some quick table interaction. What we're trying to produce here is a strategic plan. And we want to begin at the end in terms of what are the results that we want to see? What's the change we want to see? Up or down. Bring me a microphone for the public record here. Thank you, Robert. Appreciate it. So what I'm going to ask you to do is to discuss that. And how I'd like you to do it is in terms of understanding the relationship between data and results. And we're going to be working throughout the process to talk about, here's a result we'd like to have. Let's get to see what our data is about it. And maybe our perceptions and understandings may change about that, and that's all right. It's going to be an interactive process over time, and we'll develop it. And if you have your agenda here, the part that's the morning for you, if you'll look just quickly on the second page, you have this big sheet that's filled with dark print called 18 data indicators. From the research in this field, these are the factors that have been determined to be correlated with violence prevention. Remember, correlation, causation, not the same thing, but these are correlated. And so we'll be looking at data on these factors as well as other factors that you may identify in the process. So, we'll be using it. You also have a sheet in there that is labeled Hillsborough County Community Violence Prevention Collabrative, and it provides some initial data. Now, we're not going to get into that detail. The point I want to make about that data is it shows very clearly there's a relationship between poverty, between economic conditions, between violence, between events that occur in schools. So all this stuff is related, and all of you who work in the field understand this intuitively because you live that relationship every day. But we want to bring that point to you. You'll be pleased to know we're not going to review the other 7 pages of data in detail today. And you're not going to be tested on it, so it's really all right. But we are going to really rely a lot on these 18 data indicators to start our process. Over time, we may add to that. We may decide some are not as important to this community as they are now. But here's what I'd like you to do. And for those of you who are setting tables by yourselves, I'm going to ask you to move in and join a table. So, Mike, if you will, and this gentleman here. Sir, if you come up and just join one of those tables. I'm going to ask you to go around and introduce yourself, sort of which agency you're with. And I'd like you to share with the group how long you or your family has been in Hillsborough County. You don't have that to the day, but sort of make up an approximate number, if you will. We're going to use that, our first bit of data, for a decision here today. And whoever's has been in Hillsborough County the longest time, you're chair of your group. Congratulations. Okay? So now you can decide to fake it if you want to. As chair, you have significant powers and responsibilities. Make sure everybody gets a chance to say their piece. And make sure somebody takes notes, because I'm going to come around and ask a question of you based on those notes. And here's the question I'd like you to answer for me. At this moment, sitting here, what is an indicator or indicators you think we ought to be looking at so that we can understand violence in this community? Okay? No right answer, no wrong answer. Y'all don't have to agree to everything, and I probably will not have time to hear your full list. So whoever writes it, please write legibly for us, if you would. But I will ask you at least to share one that you think this is an indicator that we ought to use. Over time, we'll build a community scorecard. And those of you who are familiar with that, lets the community know how we're doing about that. So this is our first start on that, and we'll use what you come up today to start refining and using those questions and look at it. Is my request of you clear? Anything I can do to clarify it? Okay, ready, set, go. Person with the grayest hair at the table starts. Here's what I'm going to ask you to do so that we can stay on schedule. I'm going to ask you to simply report 2 of your items. If one's reported by another group, go to another one. Bob, I'll ask you to come around following their different task. I'm going to ask you to come around and collect the notes from each table after they've reported. What we'll do is we'll summarize your notes so you'll see everything, and this will become the content of our next conversation. So make sure your notes are legible. And if you think they're not, please put your name and phone number on them so that we can call you and say, what were you saying? So there's one other important item I forgot to say. For those of you who may remember, there was a program called EST in the 70s, I believe. And in EST, you paid a lot of money, and you came to sit in a room, and you got no restroom breaks, and you had a transcendental experience was the idea. Well, there are no restroom breaks here. You're on your own about that. We're just going to continue working, so please use your own time. We're going to start with the data collection committee back over there, so if you'll have whoever's going to give your report will stand, say your name, and give us 2 of the indicators that you thought were important. And Brandon, if you could take notes on what people say, please. Okay, Mark? Is on. Sorry, I lied. Or is it dead? I'll give him this one.
Hello.
Okay.
Again, Mark Hudson, City of Plant City. We just had a free flow of ideas here, talking about the different data sets that may be necessary in doing our analysis. There's quite a bit of discussion. A lot of that data is stored in different silos, and that may be some of the problem of not sharing the information back and forth. There was a lot of discussion concerning one of the factors concerning under safety, gang-related crime, and the difficulty in potentially collecting that data, or if it is actually available. So we talked about that for some time. Also, we felt that there's some individuals that we need to be involved with this process that aren't here today.
Okay.
That have a lot of source of information that may prove beneficial. For example, like the Planning Commission or the Children's Board.
Okay.
So we want to be sure to interact with them and see what data they have available that may be useful in this overall process. As far as concerning the other data points, I mean, all of them here that we looked at seemed important, and some are more readily available than others.
Okay.
So that's where we got to in that brief discussion that we had just a few moments ago.
Great. Thank you very much.
And mainly just introducing ourselves, because it's interesting that we're all somewhat in the trade, but we haven't met each other before today.
Well,
So.
one great benefit of this process is we're all going to get to know each other a lot. Thanks, Mark. I appreciate it. Education Committee, who's reporting? You'll say your name and give us at least a couple of indicators.
Hi, Kathleen Heidi. We actually had a lot, so I'm going to just try to talk fast and go past 2. Poverty.
See how well people work with me?
No, we got a lot. Poverty, school achievement, dropout rates, lack of mental health services, and also a need to develop emotional and physical skills. We looked at the structure of the family in terms of parenting, supervision, meeting of basic needs, unemployment, need for conflict resolution skills so kids don't get into fighting and violence. And we also talked about high-risk behaviors. So maybe in the interest of giving others some time, but we came up with quite a few.
Well, thank you very much
you.
for sharing that, Minnie.
All right.
Okay? Who's reporting here? Judge?
Hello, good morning, Jack Espinosa. We came up with a couple of things under indicators and protective factors. Risk factors are substance abuse and untreated mental health, untreated mental health and substance abuse. We categorized a dysfunctional family, since we all understand that the family is the first unit of government. And we also specifically talked about generational substance abuse and untreated mental health. Protective factors, of course, treatment. And under that treatment section, early identification and intervention. The earlier, the better.
Great. Thank you, Judge. Let's go to our Public Safety Judiciary Committee, who's reporting. If you'll stand. Introduce yourself, please.
Good morning. Dan Jorman, University Area CDC. I could just say ditto and be done. I mean, we had about 7, and they pretty much mirrored what we're hearing from the other groups. The 2 that came up the most for us that are easily quantifiable would be the poverty rates and looking at transients in the community.
Great, Dan. Thank you very much. Let's go over to Faith Community, who's reporting.
I'm Ted Phelan, pastor of the Community Church in Temple Terrace, and the oldest one at my table, so I had seniority. Been in Hillsborough County 67 years. 2 things that we lifted up are religious participation, which we feel like should be number 19 in the factors, and also domestic violence wasn't specifically listed, and we wanted to think that's important, and the involvement of churches in our schools. And when I say church, I mean all religious organizations, not just Christian churches. But we think that the churches should be more involved in our schools.
Thank you very much. Let's go to the community organizations.
Hi, I'm Andrea Lane with the Junior League of Tampa. One of the first things we talked about is we wanted to have a better definition of violence and violent crimes. We have some experts here at the table related to sex crimes and human trafficking, and so we agreed that we needed to include that as part of this. And then we specifically agreed that a lot of the 18 indicators were really good, but we agreed that there were quite a few risk factors that were not included, and really focusing on children, the number of children in foster care, the number of Title I and Renaissance schools, the number of kids completing kindergarten through 5th grade in the same school, which allows you to measure the transient population. So, and I think, and FCAT reading scores at 3rd grade level. So that was it. Thank you.
Thank you. Communications.
Good morning. I'm Steve Hegarty with the Hillsborough County Schools. We're going to do a lot of dittos here since we went last. Success in school is a huge indicator, and there's a lot of things that we can contribute to that in terms of data for the committee. Poverty, we agree with that. We would intersect that with economic opportunity, because when you see communities where there are no opportunities, people have time on their hands and they have no, possibility for success. We're also looking at family stability, which is kind of a squishy idea, but I think that is a very important thing. Stability of the family, supports for the family, so that things that are problems do not get to be violent problems. We had a number of other things having to do with mental health and support in that regard. So these are things that were said earlier. It's amazing how many of these intersect. Thank you.
Thank you, Steve. Thank y'all for doing that. And I think, as Steve said, we see a lot of overlap, and that's going to be helpful to us as we build our model about how to do this. One of our challenges in doing this is each of us come here with our own set of life experiences, professional training, way to look at the world, and our own set of terminology, which are all valid and important. For us to be most effective, though, we need to develop and understand and share a sort of common intellectual framework so that we can talk to each other about this and work effectively and usefully. And that's the purpose of our next agenda item, is really to start to understand that. And so Annie and Benita are going to take us through some introduction to the model that we're working on. So.
All right, I think I am mic'd, so that should be easy. Good morning. So I'll introduce myself, because I'll get to know you a little bit over the next few months. My name is Annie. I work at Prevention Institute. We're a nonprofit based in Oakland, California. And I've had the pleasure over the last 5 years to work intensively through the Unity City Network, which is funded through Centers for Disease Control and Prevention, through public health, to support big cities that are looking at preventing violence. And so I've been able to go to the beautiful cities of Newark and Chicago and New Orleans and Minneapolis and really help them through a process very similar to this. So it's a real treat to come out. We don't get to go to the South too much. I've been talking about manatees nonstop with Bob in the back, but haven't seen one yet, so cross your fingers. But besides that, this is what I do. I love talking with folks. I love getting to meet folks and really starting to kind of unpack what violence means to you in your community, how you're already addressing it, what you're already doing. And so the activities today are to get a better understanding. I love that the data committee already had their aha that you know each other, you're working on some of the same issues, you don't know each other, but you're working on some of the same issues. And that's going to be kind of a microcosm for what we'd like to do, is to get folks who've been thinking about this issue really coordinating a little bit better and identifying if there's some things that aren't being thought about, and then figuring out if they do need to be thought about and in new and different ways. So shouldn't be so much today about new things, but really about thinking about how you already are doing what you're doing and how that fits in with each other. So we started this morning with the data indicators, and this will be kind of a framework that changes, but it's undergird the whole process, which is, what do we want to see change? These are all things that we know, if these change, violence will go down, right? This is the kind of science piece of it. And what you all will figure out is what these will look like in your community. So you'll be able to fine tune, and maybe I think you said FCAT scores for 3rd grade reading, right? So that's the level of refinement in your subcommittees that you're going to be doing. You're the experts on that. You're going to make the recommendations to that leadership council and put that into the strategic plan. One of the first things we do when we work on preventing violence is risk and protective factors. So there's a short list on that first page, but on the second page, we have a much more comprehensive list. When you want to prevent violence, you cannot just focus on risk. Your law enforcement here will tell you you can't arrest your way out of the situation. I always tell social workers you also can't parenting class your way out of the situation either, right? There's a good multi-sector piece here. What we've done is we've pulled together the most common risk and protective factors that cities and counties use. You'll hear me use the word city a lot, but that's because of the language through the CDC I've been using a bunch. City, county, municipality, forgive me for switching them together. I know they're different. So on this, we have a chart called socioecological level. Anyone here familiar with that? Use that in their work? Sociological levels? We have one hand. Can you stand up? Can you explain kind of what that is? And introduce yourself, please. Oh, of course we have a public health person in the audience. I'm going to use a microphone so that we can hear. Thank you. Oh, I don't think it's on. We're going to traumatize you all. Make use the mic, and then it won't work.
Okay, what the model is it working now?
Yes, thank you.
Basically, what the model says is that there are interrelating levels of things that affect each other in an interactive sort of way, and that you start with things that are at an individual level, that it interacts then with things that are at a relationship level, such as the way you relate to family or other people in your immediate surrounding. Thirdly, that those interact with the community, and that both of these things interact individually and collectively with the community, and then the same at a societal level, so that you build from an individual focus to a societal focus in sort of an increasing and interactive, integrative way.
Well done. Thank you very much. And so the idea in this is really acknowledging the important influence that society and community and relationships have on individuals. That a lot of times this narrows focus on these bad kids or these bad characters. And what we know is that that's actually not an effective way to prevent violence. That there's so many influences in the larger culture that you can't just focus on the individuals and be successful. And I always tell the story of my coworker and peanut M&Ms. And she had peanut M&Ms on her desk, and I don't have a particular thing for peanut M&Ms. But every time I would walk past, I would see them, and half the time I would grab one and eat a couple. And I got to the point where I was like, yeah, Annie, you're not into stop eating all this candy. We're a public health organization, right? And so I would not, purposely, and then I would try to avoid the desk, and then I would end up, and I'd realize I was eating them, and I didn't even realize I had them in my, when did I eat this, And it's so easy when things are accessible to you, when they're out, that you start engaging in them, even if you're not consciously seeking them out. And this became very real when a young person said to me, Annie, if I want liquor, I can go to the store on my corner. If I want cigarettes, right there. If I want a weapon, it's 4 houses down. But if I want school supplies, I have to take the bus outside of my community. And so what we're doing in this process is acknowledging the responsibility of individuals to be responsible for themselves. But as a community, we're acknowledging the environment that young people are growing up in. We're acknowledging the norms in the communities and the infrastructure in the communities for families. So that when people do feel stress at the individual level, we have an infrastructure and a support system that everyone needs to grow and thrive. So these levels, you'll see, we have things at the relationship and the individual level, but we have more at the community and societal level because that's where you all can be most effective. It's the most effective place to intervene. So what I'd like you to do is to take a minute, look at this list, and think for yourself, what are you already working on in the job that you have now? What is your organizational mandate? What are the things you're having to report back to your supervisor? What are the things you're measuring that are important to you? And just note which ones are probably the most important in the work that you already do. And I'm going to give you a minute or two to look at that. All right, And then the final thing I'm going to have you do with this list, and then we're going to go back to the large group, is just put a different type of mark, but note which you think personally in your professional expertise is most important to preventing violence in Hillsborough County. So it may not be your primary focus in your job, but what would you say is some of the most important things to work on in Hillsborough County? And just put a different little notation on that and maybe choose 2 or 3 based on your expertise and your experience. And I should say focus maybe is the right word. Maybe that folks are already working on it and it could use more attention, and maybe that no one's working on it, that there's been some success, but there could be more with more attention. All right, so now we're gonna have you work at your tables again. And I'm gonna ask you to look at the worksheet here on the next page. But this is the first step in making recommendations. So as your committee, what we'd like you to do is think of 2 types of recommendation. The first recommendation is what your subcommittee thinks you're already doing that might impact risk and resilience factors. So some of the work that you're already doing that actually may be moving or focusing on these areas. And the second is areas of the broader Hillsborough County focus. So the first one is specific to your subcommittee. So for example, healthcare subcommittee, you may have kind of some specific risk and resilience factors that are more pertinent to your work. But you're also, as part 2, making a recommendation for Hillsborough County more broadly. So there's 2 sets of recommendations that are going to come out of your subcommittee in the next 45 minutes. And these are preliminary, right? We're not writing anything in stone at this point, but we need to have a sense of where to focus. And so what we'll ask you to do is share in your table and come to a consensus about some of the top pieces, okay? We're going to do share out to the larger group. And what we'll ask you to do then at that point is to see where some of the points of overlap and consensus are. And then we're going to allow a little bit more discussion about what should be a final piece. Because what I'd like to do this morning by our break time is have some prioritization by subcommittee, but then also some consensus around the broader group on risk and resilience factors. So that you may have some specific to your subcommittee, but we also have some kind of at-large, if you will. Okay? That makes sense? Great. So you're going to have 15 minutes to work on part 1, which is your subcommittee, 15 minutes to work on part 2, which is the broader at-large recommendations, and then we're going to come back to do sharing. So I'm going to let you work at your table for almost 30 minutes, which is a long time. So I will be visiting. If you need a facilitator, Benita and I, this is what we do. Just throw your hand up and we'll work on it, but you all are professionals, you know what you're doing. So we're going to let you come to that consensus on your own and then just kind of float. All right? Any questions? Yeah, and in fact, let's write them up here so we have a little cue. So your task is to identify, oh, well, that didn't work, 3 to 5 risk or resilience factors. You can see I wasn't hired for my handwriting. For the subcommittee. And this is stuff you're already probably doing. And then all for Hillsborough County at large. And 3 to 5 is inclusive, not 5 and 5. Does that make sense? 3 to 5 total. Yeah, I want to distinguish between kind of your subject matter expertise and your global vision for the community of Hillsborough County. Yeah. I probably could have explained that better in the beginning, so. All right, and so you have about 15 minutes for each side, and then we'll be doing report backs. All right, so we are going to come back together and get to hear from you all. Benita is going to do some note-taking. And so just as a reminder, we're going to look at factors for Hillsborough County and subcommittee factors. I'm going to go ahead and have your committee report out on both at the same time, just for kind of ease of logistics. And I'm going to be writing for my purposes. Can I have someone run a mic? Okay, you got a mic? Great, thank you. And it looks like maybe the data subcommittee is first in terms of their proximity to the mic runner. Surprise. So we'll start at Dave committee, we'll go to education, healthcare, kind of, and just snake, and we'll wrap up with communications, which is what a nice way that worked out. Okay. Thank you. And if you could introduce yourself and your agency, that would be really helpful, just as we get to know each other. And apparently it's a rite of passage that your microphone will not work.
Heather, Jeff Akins, Hillsborough County Public Schools. So we found out from Annie that we're a unique group. So in the communities, there are educators, there are healthcare organizations, there's public safeties. There is no such thing as the data collector folks. So we're unique. We found that out. So she helped us. Thank you very much for helping us through the process. So as we looked within our group, first of all, the agencies that we represented, we really felt like the areas for our group was the educational information and data. That was the piece, the crime data, and the substance abuse, mental health areas were the areas that we were focused on as a subcommittee.
So what we asked was those were the pieces that they're already collecting and focused on as part of their work. Yeah.
Right.
Great.
So as we look more globally across Hillsborough County, we kind of ask the questions, when people want to come to Hillsborough County, what are the questions that we get asked? What are the questions that the EDC gets asked, the different agencies? So one of the first things that gets asked, we found out, was what are the schools like in your community? So quality schools was definitely an area. We felt like that a second area of resiliency was coordinating across all of our agencies and all of our resources. And we all have very influential resources within our agencies. We just have to coordinate those, and that's one of the areas for resiliency that we felt like could be looked at. Definitely employment and economic opportunity is certainly an area. Access to mental health and substance abuse support. And then when it comes down to just the family structure, one of the risk factors that we identify that really to be addressed is the poor parent-child relationship and any family conflict. We felt like that definitely is something holistically across this community to address.
Thank you. Let's give them a round of applause.
Hi, Kathleen Heidi with USF, and we had the Education Committee with people from the Court Administrator's Office, the school system, State Attorney's Office, the Mendez Foundation, and then USF College of Public Health and Criminology. I think I forgot one person. And then, Stetson Law School. And then, of course, I'm sorry, very important, the Sheriff's Office. So thank you. We came up with several things that we would like to target as the Education Committee. That included the coordination of resources and services among community agencies. Second one, connection to a caring adult. I'm probably going too fast.
No, you're fine.
All right. Third, skills in solving problems nonviolently. The fourth, we had connection and commitment to school. And the fifth, high expectations. And we also had quality schools.
Okay.
So that was under what we'd like to target. And then what we think is important, And you want me to go into that, what we think is important for the county? Is that right, Annie? Okay, for the county, we would say connection to a caring adult. We would also include poor neighborhood support and lack of cohesion. So that's a risk factor. We'd like to see that addressed. A third one that we'd like to see the county address is media violence, and we would include with that the social media and the messages related to drugs, alcohol, sex, bullying. A fourth one is we'd like to target mental health problems, at least have the county target mental health problems, alcohol and substance abuse. And then the last one, community design that promotes safety.
Okay, great. Thank you very much.
Hi, everyone. I'm Jason Wilson from Tampa General Hospital, representing the Healthcare Subcommittee. So for the, we kind of had a common theme as we went along, and it was really coordination of the resources that are available and moving from basically a disjointed list of resources available towards mental health and substance abuse. That's kind of our major theme over here, and sounds like the same thing at other tables too. So most of our resilience risk factors tend to focus around that in some way. And then for the subcommittee risk factors, access to mental health care services, coordination of resources, community support and connectedness, and employment and economic opportunities. And then for the risk factors, mental health problems, alcohol and substance abuse, family conflicts, weak health, educational and economic and social policies, and then incarceration and reentry, because we sort of see the criminalization of mental health as very difficult to move to the medical model for mental health with the criminalization of mental health. It becomes a circle where it's harder to employ people, it's harder to move people out of a disjointed lack of system. And then access to weapons as well. And then for the Hillsborough County broader, what we can bring to that, I guess, would be coordination of resources. We really came back to that over and over again, coordination of the mental health and substance abuse resources, how to plug people into the right care at the right time, and then follow them through that system so it actually becomes a system instead of just interventions of acute care crises. So follow through that system if we could build it, so coordination of resources and access to health care. I think that's about it. Do you guys have anything else to add? Okay.
Great. Thank you. Oh, both groups needed a good round of applause. Apologize. All right.
I'm Tracy Mishler. I'm with the Public Safety Judiciary Committee. Some of the factors we came up with were we want to make sure the resilient factors. We want to make sure we involve the community in buying into the community and feedback from the community. We think that's very important to hear the community and what they think about it also, not just what we think about it. Relationship building, like I said, all the different law enforcement agencies, we all have different ways of building relationships with the community. I'll give for an example here in Temple Terrace, we do a program called Do the Right Thing. We tried to identify children who, and that way they can be recognized because they did the right thing, not because they got arrested and got their name in the newspaper. Addressing symptomatics to strengthen the neighborhoods, or symptoms in the neighborhood, maybe rundown homes or rental homes or foreclosed homes, or just working together with groups like our code enforcement officers to clean up neighborhoods, because again, it hasn't changed for many years, but we talked about something called the broken window theory for many years in law enforcement. So I mean, crime goes along with that, and of course a lot of crimes, violent crimes especially associated with prostitution and drug violence and things like that, which will occur in a neighborhood that doesn't look like they care about it. Collaborating with our interagencies and sharing resources to solve crimes. Here in Hillsborough County, as a longtime law enforcement officer, I can tell you a lot of times we were we take care of our own. We didn't really share a lot of information. We've changed that in the last few years again. We've constantly are meeting to share intelligence information and identify crime patterns and areas that crimes are occurring in, and as fast as we can, to move those resources to those areas to try to solve the problems in that particular neighborhood. Of course, as law enforcement officers, again, one of our jobs is also, we have community resource officers in the schools, we have community officers in the neighborhoods, crime prevention officers, and even the patrol officers are all important in providing resources and services, information to the public as they go to a call. So not only should you respond to a call for services, but sometimes you have to provide that person with the resources. And we have a nice little form we can use here in Hillsborough County. It's called 211. Where you can just give out a little flyer and I always kind of like to leave a person after I leave them with giving them some information myself, leave them with some resources that they can call and contact them at a later date. I didn't really break it down too much between Hillsborough County and the subcommittee factors, but some of our risk factors were, of course, we identified as poor parent-child relationships and conflict. Domestic violence was one of them. Single-parent family, that was very important, I think. Again, I heard a statistic the other day, 70% of incarcerated people in the state of Florida come from single-family homes. That's I don't think there's any way to solve that problem personally, but again, we can work towards that end. Lack of cohesiveness in the community itself. In other words, the community not working together to look at crime issues and violent crime. And like I said, I'll just reiterate community deterioration. Again, rental homes, foreclosed homes, and working together with our partners in code enforcement to identify areas that need assistance.
Great. Thank you very much. So one of the things I did was translate some of the things you said into the language on this sheet, just for the purposes of consensus. So I want to make sure you're okay with it, but it's poor neighborhood support, lack of cohesion, community deterioration, poor parent-child relationships and family conflict, coordination of resources and services among community agencies. About right? Okay, great. Thank you for that. And thank you for the detail. It helps kind of understand which ones you've chosen for the focus. All right, where's the microphone? Great, thank you.
Hello, my name is Shakita Hargrove, and I stand to represent the Faith Community Subcommittee. The risk factors that we have for the subcommittee are poor neighborhood support and lack of cohesion, incarceration and reentry, poor parent-child relationships, family conflict, academic failure and failure of the school system, and diminished economic opportunities, high unemployment rate. The resilience factors that we have under subcommittee are collective efficacy, willingness to act for the common good, employment/economic opportunities, connection to caring adults, access to mental health and substance abuse services, and norms that support nonviolence and alternatives to violence. The factors that we have listed for Hillsborough County are under risk factors. We have weapons, mental health problems, alcohol and substance abuse, and neighborhood poverty. Under resilience factors, we have collective efficacy, willingness to act for the common good, community design that promotes safety, coordination of resources and services among community agencies. And one of the consensus that we've had was that we need to limit the access of alcohol, drugs, and any other tools or materials that influence delinquency among our youth.
Okay, thank you.
I'm Carolyn Collins, and we're with the community organization group, a number of organizations working in the community. So we were a little backwards with our presentation, but we'll go forward with our presentation. We worked the other way, but I'm going to reverse it. As it relates to the varying organizations, we came up with about, I think you said 3 to 5. We have, and you said overall, resiliency, we have connection and commitment to schools, connection to caring adults and relationships and attachments, as well as coordination of resources and service among community agencies. With the risk, from our perspective on things we thought we were already looking at or working with, was media violence, low educational achievement, and weak health, educational, economics, and social policies and laws. Of course, we had an opportunity to divert a little bit and talk about policies and bills and laws that actually inhibit the progress in these areas, and a lack of utilization of some entities that are open in our church on a few hours, our community a few hours every week, and we're not utilizing those as well. Under the community, we did 2 resilience and 3 risk. The resilience was coordination of resources and service among community organizations, and employment and economic opportunities.
Okay.
Under the risk, the poor parent-child relationship, family conflict, the mental health problems with alcohol and substance abuse. And then last, the risk was, again, the low educational achievement, which we felt had a significant impact on whatever we were trying to do, be it health, economic development, et cetera.
Great. Thank you very much. All right.
Steve Haggerty with the Hillsborough County Public Schools. The Education or the Communications Subcommittee, much like the Data Subcommittee, we feel that we're unique in some ways in our scope. And as a result of that, we got special permission to jump right ahead to the county-wide perspective, which is what we did. We were particularly drawn to a couple of resilience factors and risk factors that we thought encompassed just about everything. We kept adding things to the list and then saying that's really included under this other category. We highlighted the community support and connectedness, and there are so many things, a connectedness to an adult, a good education system. Many of those things seem to fall under the general category of the community support and connectedness. In addition, the other resilience factor that we focused on was coordination among community agencies, which today is an example of that. Under risk factors, the one that we thought most encompassed many of the other categories was the weak health, educational, economic, and social policies and laws. And so many of the other risk factors, I think, fell under that. So that's what we focused on. We also, because we're overachievers, we had a thought that we would like to throw out there, since we only came up with 3 without taking too much time.
Please.
Okay. We discussed things like the crime rate and things like that. And there was a fascinating discussion among my colleagues here about when you look at the crime rate, then you look at the violence crime rate. Is there any way, and perhaps this has already been done, to look at sort of an index of lethality, depravity, or something? Because once you look at violent crime, beneath that, when you sort of unpack that a bit, there's so many other things that we learn about anecdotally, and my colleagues know a lot more about it here than I do. And it was a fascinating discussion. I just wanted to throw that out and see if it's already been done or possible. Just a thought.
Yeah, no, I don't think I understood your complete thought, though. So what part has already been done?
I don't know that it's been done.
No,
I think that we
what?
will be able to grab crime stats, and beneath that, violent crime stats. Beneath that, is there some way of getting at the depravity, lethality of those violent crimes? I don't know if there's some way of getting at that. Because I think both crime and violent crime are going down.
They are?
Yeah.
They are.
However, perhaps the lethality, depravity, ugliness, which is what we're discussing over here, anecdotally, that those things might be on the increase.
I see what you're saying. Okay, thanks for bearing with me.
Just a fly in the ointment.
What
yeah.
you're saying then is that we know that violent crime is going down, but perhaps, and putting my words on it, the stuff that's left is really ugly, stubborn stuff. That some of the great work that's already happening has really dealt with some of the pieces that were maybe easier to reach, easier to prevent, and the things that are left are a little bit more ingrained, difficult. Depravity is the word you're using. I'm not exactly sure what
yes,
the
and
meaning of
the
it is.
Communications Subcommittee thanks you for expressing it better than we did. Thank you.
I just wanted to make sure I understood what you were saying. Super.
Absolutely.
Okay. Well, stay tuned for this afternoon, because the focus of this afternoon is to take the pieces that you have highlighted and pulled out and talk about how we understand it and how we understand how to prevent it. So the good news is there's really good prevention science on this. It's about 20 to 30 years of amazing research at the university level, at the community level, to understand what it is to prevent violence. And so we'll be highlighting what other cities have been working and kind of their success for what works, specifically around these areas. I do want to take a minute, and we'll end right on time. I want to take a minute and kind of reflect back some initial things that I saw. And clearly, there's an interest about coordination of resources here, that there's some work that can be done that would be beneficial and valuable around the coordination of resources. And so that came, I think, that was easy, loud and clear. And then there was some other consensus around community design that promotes safety, some at the parent-child, and what's nice from a facilitator's perspective is that you all chose a couple at each levels of that socio-ecological scale, which is great. When you do a plan, you want to make sure that you're not all here or all here, but that you have a good mix, and there was definitely some consensus around that mix. And what we'll do between here and our next meeting is do a little bit more of the connections between the risk factors and resilience factors that you chose and the ones at your subcommittee as well. So we're going to keep revisiting this, but clearly coordination came up a lot, access to mental health, alcohol, substance abuse came up a lot, community design, and those connections to the caring adults and education. I would say those 4 themes were pretty consistent. What I'd like to do, though, is did something come up that for you bears discussion? And I'll give you an example. I was in a different community, and one of the things that came up for them is not on this list, but they said that the relationships between different ethnic groups was one of the most difficult things for their community, and this was an opportunity that they wanted to work on it. So we had done this activity, it hadn't come up, and one woman stood and brought it up and said, look, I think this is important. It may not be what we're already working on, but this is an important issue. And she made the case for why it was important. And that instance, it carried all the way through and became part of their strategic plan. So what I'd like to do is to turn it over to you right now and give you a minute for, all right, based on these things that you saw coming up, is there anything that we're missing that maybe because of where we are, we have a little bit of a spot line list to it, that you think bears just one more point of discussion, one more point of repetition, just to include it. So I would like to just open it up for kind of some things that haven't risen to the top yet. It's an important part of consensus, so please. Oh, and I have to give you a microphone. So it's coming. And again, nothing's set in stone today. This is really the time to kind of generate these ideas. Thanks, Benita. I can put this one over here.
Maria had an excellent point while we were sitting here chatting a little bit. There is a lack of providers as well for accessing some of these mental health and substance abuse issues. We were just sitting here chatting for a few minutes, actually. On my hand, I can count, there's probably less than 10 adolescent psychiatrists in this area. And of those 10, how many of them take Medicaid? It's probably 2. And so what is the waiting time for an adolescent psych appointment for a Medicaid patient, right? I mean, you're looking at months. So just provider shortage, and then going along to making sure to get to the right provider at the right time.
Great, thank you. In the back? And then we'll come over here.
This is one that didn't come up in our group because it's really specific to the neighborhood that I serve, but
which neighborhood is that?
it's a university area. A lot of people know it as Suitcase City near the University of South Florida Tampa campus. And that is policy with undocumented populations. We have a very large undocumented population, and it's a violent crime driver in the sense that we see a large number of people getting jumped coming out of payday lenders because they're not using traditional banks, and criminals and gangs know when they're getting their money, and they're jumping people, and what that's leading to now is more Hispanic gangs forming, as people who are undocumented aren't going to the sheriffs because they're afraid of being deported, so they're instead forming new gangs to retaliate against the gangs that are jumping them. So we're seeing that escalation in violence because of that.
Okay, thank you for sharing that. All right, I think there was a comment at this table here. Yeah, we're gonna do 1 and then 2. Thank you.
Hello, I'm Margaret Lang with Victim Assistance. And one other item that did come up in our discussion were the roadblocks to accessing the resources. If a person is unemployed or they don't have an education, they need transportation to get where they need to go to get the job, the education. They need daycare for the children. And those are some of the other areas that are lacking or difficult to get people to access.
Yeah. So, you know, when families are in a stressful situation, it's those community infrastructure pieces of transportation, quality daycare, making sure they're accessible.
Right. It's easy to give them, you know, go and see, you know, at the mental health center at the community mental health center. But how do they get there? The basic, how to get there. Do they need bus vouchers? Gas money? What can help them to get the resources that they actually need?
Great. Thank you very much. Not here.
It's actually listed on the form as policies with one thing I wanted to mention, and I think that's where we were, is the policies that's actually a roadblock. There are services that are out there, and there are programs that are out there, and there are funds that are out there, but because there are policies that have been set up in the organization, the policies does not allow those funds to be readily available or individuals to go out and provide that service to the community. And so while it's tied into policies, I'm not too sure where we were with it, but we're concerned about that. And then another one that is policy, but we haven't addressed it, the unemployment piece, is there's just far too many individuals, and you kind of brought it out in your discussion, but we're finding a large number of individuals who actually are applying for jobs, lived in this community all their lives, was arrested coming out of high school, probably petty, but they were arrested and given a record, and those individuals are not eligible for employment, and this happened 20 years ago. They've since that time raised their children, they have gone to college themselves, and they cannot find a job because they'll go back 20 years, but they may be in a room full of people who are applying for the job, and many of those individuals just came to America 5 years ago, and they have no record in America for 5 years, but they may have a record elsewhere 15, 20 years ago, and they're being inequitably compared. So something, whether it's policy, whether it's employment issues, but some kind of way that we could sensitize people to actually what we're doing with some of those policies that are hindering, because if they can't find a job, they can't feed their kids, they can't pay their rent, they can't do this, ultimately they revert perhaps to crime.
Yeah. There's, I'm not gonna, it'll create a buzz. There's we call it reentry, which I think is interesting because your point is sometimes reentry is still impacting folks 20, 30 years later, right? But there's a whole body of work and research and policies around how to be more thoughtful about reentry. We've incarcerated a lot of people in the U.S. It's a thing that we do here. And so now that we've had this history of 20 years of incarceration, especially in urban areas, we have a huge population that have a record, that they're no longer incarcerated, and yet they have a record. And there's a little bit of a mismatch between our social policies and the characteristics of the populations, especially in urban areas. And so the good news is there's a lot of people that have been thinking about that, and there's some good policy models for thinking about how to kind of be realistic about it and thoughtful about it. Because clearly, you know, you're not saying that records don't count at all ever in any circumstance, and that we can be more thoughtful about, you know, what our intentionality is. Absolutely. Thank you for that. Any other? We got one in the back, and then we're gonna transition here.
I wanted to reiterate what the facilitators said earlier, which is multicultural awareness and education. I believe that once we are informed about the various cultures that we deal with in our communities, then we'll be able to understand them better in order to treat them and to intervene and prevent certain crimes. Because sometimes the way a person behaves or the way they think is because of their culture. And if we treat them based on what the majority culture is, then we've lost them. We can try to prevent and intervene all we want to, but if we don't understand their culture, then we still failed. So I would say multicultural awareness and education.
Great, thank you.
Okay, I'm gonna become real quick the most unpopular person in the room. but I'm gonna share this because I think it's worthy to be shared.
Do you mind introducing yourself?
My name is Robert Blunt with Aide Brown Ministries here in Tampa. It's interesting that most of the comments centered around coordination and collective efficacy. And one of the dynamics in our subcommittee here was we have representative from Temple Terrace, representative from Grant Park. And as these issues surfaced, the thought was put on the table that perhaps we need to lead by example in coordination and collective efficacy between the various municipalities that are responsible for our community. Because you can have a conversation with the city of Tampa and they'll point you to Hillsborough County. You can have a conversation with Hillsborough County and they'll say, well, based on that zip code, you're in the city of Tampa. And some of the most progressive programs that are taking place in our state are taking place where there's consolidated government. And so there it is.
So what I understand consolidated government to be is less focused on city versus county versus unincorporated area and more focused on this is the community and we're going to make sure that the services are available. So it could mean city, county are combined. It could mean, you know, it's a county jurisdiction versus a city. There's all sorts of forms within that. Is that what you mean by consolidation?
Yes, it's seeing a need, hearing a call, and moving with compassion, not politics.
Yeah. I kind of feel like we should just stop. Like that may be the vision for the Hillsborough County piece is, you know, the opportunity here is to start where the need is and where the solutions lie. And the opportunity here is not to be stuck in with, you know, what's funded today and what's possible with the staffing that's available this week. The opportunity here is to think about, all right, if we're going to put our heads together and put our collective effort into this, what's our best value? You know, and it's not the cheapest, but what's our best value? If we're going to invest in this, where can we make some moves? And so this morning was really to start thinking about, all right, so if we're going to make some moves, what are the things we want to see be different? That's our data indicators. And what do we think are the things that are most underlying violence in our community, which are risk and resilience factors? And what we're going to do this afternoon is tie in that third piece of it, is what are the strategies that impact risk and resilience and will move this data. So we've kind of taken you in a backwards kind of place in some ways, but we wanted to start with the vision of what you want to see in your community, that data, the risk and resilience, how we move it. And this afternoon, we're really going to talk about what are the most effective strategies to move these types of risk and resilience factors. We'll report back on the risk and resilience factor kind of consensus, and then we'll be doing one more level of consensus the next meeting on those factors, but we'll also be at that point moving into strategy. So if you think about this process, we're planning to come out 3 times. Today was really focused on risk and resilience and a little bit on strategy. Next time, it'll be a little bit risk and resilience, mostly strategy, and then the third visit will be putting together kind of the pieces of the plan. Okay? We're going to be here all day, so this is a quick introductory visit, but feel free to come chat with us at any point, bring questions. The staff here are just impressive. You can call them at any time for questions. And did you have a... I understand that there is no meeting for subcommittees in October, and then the next meeting will be in November, because it allows us time to do the analysis of all of the data that we're collecting today. Yeah, no problem. All right, I think with that, we will adjourn. Thank you very much for your time. Oh, we got a hand in the back.
Just a quick bit of information. The next event starts at 1 o'clock. In the meantime, there's a restaurant down here at the end of the hall that serves sandwiches and other lunch items. And there's also the Marriott across the street, so you don't need to go